private choice. We need the public choice because the private sector, has not been able to meet that 47 million that's out there. Why? Because it's not affordable. And even if it's a given as the testimony that you pretty well, Mr. Chamberlain, provided, even when it is, even when they have insurance, it's not accessible. They'll find one reason or another. You know, when you're healthy, it's okay. Right. You got insurance. I got insurance right now. Blue Cross Blue Shield, the same thing. But as soon as you get sick, you'll find out. And so we have a serious problem whether you have insurance or not. So the other issue from it, and I go back to the economic situation. I mentioned the states that were in trouble. The number one reason that they were in trouble was the cost of health care. As provided by your testimony too, the number 1 out of 6 that declare bankruptcy individuals is because of health care. The hardest, you know, for people like AT&T and those major corporations, they try to do the right thing and provide health care for their workers. But at the same time, they're having to pay for everyone else that's uninsured. So we're saying enough money is going out there to play for health care. We just need to figure out where it's going and begin to do the right thing, because we pay more for health care than anybody else in the world. And so the bill that's before us makes an attempt to, number one, bring down the cost by looking at the cost of prescriptions, as indicated earlier here by your own testimony. And we know that they charge us from 100 to 300% higher than they do for the same item, same company in Europe and elsewhere. So what's wrong with that picture? So we know that we have to make a difference there. We know that the last bill that was passed by the Republicans, and mainly passed by enough of the Republicans, and Jesse did a beautiful job of sharing the history there. It was a bill that basically created that so-called privatization of Medicare. You got me on the record voting no on that. And that began to dismantle and destroy Medicare as we know it. So we have a system. And then from a taxpayer perspective, if you're concerned about your taxpayer dollars, if you're on Medicare Plus and you're on straight Medicare to the taxpayer, and that's in addition to the fact that you're on Medicare Plus, you got to pay additional $200-300 a month. You're still costing me more. So it hasn't worked. It didn't bring down the cost. It brought up the cost. We have too many people involved in health care that are not providing care. We have too much